digestion,
Mm-hmm.
right? Digestion, elimination. How important is eliminating properly, like eliminating the waste out of your body, aka bowel
Yeah.
movements? I don't know why I'm getting on this,
Yeah.
but for some reason I thought of it.
I think it's pretty important. I mean, I've had a lot of gut issues my whole life.
Yeah.
And I may even have Crohn's disease. I'm actually in the process of getting tested for that.
Yeah.
'Cause I've had all these gut issues, and I mean, a lot of it is definitely from the food allergies, but
Yeah.
some of it also could come from the things in our food.
Right.
Our food is terrible.
Terrible.
Which is it's great that we got RFK in there because he's eliminating a lot of these things.
Yeah, what's RFK doing? Let's talk about his mission.
Oh man, he's just basically trying to stop Big Pharma from bending us over. I mean, they've been bending us over for decades. And yeah, he's a hero. I mean, if you just look what Fauci did during COVID.
Yeah.
I mean, he basically burned 30 million pills of ivermectin that were in the federal stockpile, and ivermectin was known to be great for treating COVID. Very, very cheap drug.
This is a known thing that they literally burn them.
Yeah, it's known. I'd recommend anyone to read RFK's book on Fauci. It talks about all this stuff, the things he did with AIDS. But yeah, he's one of the biggest criminals we've ever seen in this world.
Ever.
Yeah, and so basically, ivermectin won a Nobel Peace Prize. It's known to help with COVID symptoms, and they burned them in order to push the vaccine on people, so these big pharma companies can make a lot of money. It's just, and now you see all the issues with the vaccine.
Tons.
Like one of the things that stem cells are great for is treating COVID vaccine injury. Because
you're seeing it in your clinic.
Oh yeah, I just had a guy down last week. He was there for 10 days. He did 2 rounds of stem cells, and he said he hasn't felt this good in 5 years. Started crying on his hotel bed, and then wanted to double up his stem cell dose
because he took the vaccine.
Yeah, so so the vaccine can cause both neurological and circulatory issues, and one of the things that stem cells are so good at is recovering the circulatory system. And then with him, since he was having the neurological issues, we applied the exosomes through a nebulizer, which basically goes through your nose. And exosomes are way smaller than stem cells, probably about 1/50th of the size of stem cells, so they can cross the blood-brain barrier a lot easier. And yeah, he's hasn't been this healthy in years.
Wow.
Yeah.
Did he notice an immediate decline when he took the vaccine? Was it immediate?
I don't know if it was immediate, but he was in bad shape. He had to quit his job.
Wow.
But he did a lot of things on his own to improve his health. He bought one of the mats that we were talking about earlier. He has one of those at his house.
PMF mat?
PMF mat. He has a really nice one. He took ivermectin, a lot of other things he did on his own to help his health.
Yeah.
Some peptides, but he needed that push, which is why he came down and got stem cells with us. And he just did a really good video testimonial. But yeah, he was down there for 10 days, very, very long protocol. So it's 10 days of hyperbaric every single day.
Every day.
He did 200 million stem cells. He did a placental implant, stromal vascular factor, exosomes, and a lot of other things. All of our protocols are 100% customized to the patient.
Yeah.
We don't have a one-size-fits-all like most of these clinics where they just say, hey, come down, we're going to sell you stem cells, kick you out, that's it. A lot of these things are, they work very well when paired together. So all these protocols are very, very strategic and catered to the individual patient.
Okay, so now that you're getting into stem cells already here, let's go to the basics. Everybody's hearing stem cells, and it sounds really cool.
Yeah,
like it sounds really cool. I love it.
It is pretty cool.
I love the sound of it. But what are they? Let's start there. What exactly is a stem cell?
Okay, a stem cell is essentially a blank cell. So a stem cell, there's different types of stem cells, and different types of stem cells can turn into different cells in your body. So a stem cell is a blank cell. As that stem cell becomes older, it can turn into less types of cells. So the youngest cells you can have, they come from the aborted fetuses, which everyone thinks stem cells come from aborted fetuses.
Yes.
Our cells come from either umbilical cord or placenta. So those are younger. All the issues that have happened in stem cell research typically come from the cells from aborted fetuses.
Yeah.
So, and then there's also not donor stem cells. There's stem cells which you can extract from your own body from adipose tissue or bone marrow.
Yep.
And those do work well. That's typically the type of stem cells that we use in America.
Yeah.
And those they work well, but it's kind of a painful process to remove them, and you don't know how many cells you're gonna yield from that surgery. And they're also older stem cells, so they're not as versatile as the donor cells, which come from Wharton's jelly, the umbilical cord, or placenta.
What's the jelly thing? What's that?
Wharton's jelly.
What's that?
So Wharton's jelly is the jelly inside the umbilical cord. It's very high in stem cells. So basically, the birth tissue is donated. This happens in both the U.S. and all around the world. So when a baby's born, you have the option to donate the tissues. And
Of the umbilical cord.
Yeah, the cord and the placenta.
Okay.
So when you donate those, they're sent to a lab, and the stem cells are separated from the rest of the tissue. So they're very high in stem cells, but they're not 100% stem cells. So a lab has to go in there and do the separation, and it's a very, very strict and stringent process.
Yeah.
So
yeah.
typically, when there's certain requirements that have to be met for people to donate stem cells.
Okay.
So typically it's going to be first offspring, female baby, and the mother 18 to 23 years old. And you can't sell stem cells anywhere in the world. It's illegal. Everything has to be donated. And then in Mexico, the mothers are compensated with additional medical care. So it's because it can be a conflict of interest, because a lot of people could just have a lot of babies and sell their stem cells.
Yes.
So there's very, very strict rules. It's regulated by the Mexican equivalent of the FDA, and they do a lot of tests on the mother prior to donation to make sure there's no issues, no hepatitis, no other types of diseases where people could be infected by these donor cells.
And so a stem cell, you said it's a blank cell.
Yes, essentially. Yeah.
What does that mean?
So we all have different types of cells in our body.
Yeah.
We have skin cells, muscle cells, organ cells.
Gotcha.
Before those cells become those types of cells, they were a stem cell at one point. So when a baby is born, the fetus is basically all stem cells. So
yes,
those cells turn
because they haven't turned into anything yet.
Yeah, so they turn into the other types of cells in the body over time. And
incredible.
So it's pretty.
And so let's go back about where stem cell clinics are getting these stem cells, because I know people are, when they're hearing this right now, they're horrified. I'm horrified from an actual aborted fetus. Where do you guys get yours from at Luxury Stem Cells?
Yeah, so we work with one of the biggest labs in Mexico right now, but we're actually in the process of building our own lab.
Yes.
So within the next 15 days, we'll have our own lab. Everything will be built on site. And it's very important to have the lab close to where the stem cells are applied, because when you freeze stem cells, you lose about 50% of the bioavailability.
When you freeze them?
When you freeze them, yeah, because they're very fragile. Stem cells are very fragile.
What's the shelf life, quote unquote, of?
If you freeze them, it could be a while, but we prefer to not freeze them, because you're going to yield way closer to 100% of the bioavailability of the cells. So our exosomes are basically harvested the day before the procedure.
What's an exosome?
So an exosome is it's basically a byproduct of a stem cell. So stem cells secrete exosomes.
Yep.
Exosomes are responsible for intracellular communication. So they direct cells in the body and kind of instruct. They're kind of like the CEOs.
Yeah.
They tell different cells in the body what to do, and they're very, very good to be applied with stem cells, but also as a standalone treatment. So one of the popular treatments are exosomes facials. So basically, you put exosomes on your face.
How do you put them on the face?
You get a microneedling device.
Yeah.
So we have a microneedling device. We microneedle the face. We put them on top, and then we can also inject them deeper into the dermis. And it's way better than Botox. Doesn't make you look like a fish, and it's phenomenal.
And you can actually move your face.
Yeah, you can move your face.
Yeah.
Yeah. I'm moving my face pretty well right now.
You get it? Do you get it done?
Yeah, I've got it done.
Oh yeah.
Yeah.
And your skin looks great.
Yeah, it's
$1 million bucks.
It's doing all right for
It's all
my
right.
age.
Yeah.
I mean, I'm officially, as of this year, I'll be middle aged.
Yes, officially.
35, yeah.
Welcome to the club, bro. Nice job. You made it. All right. So, and then your stem cells, are you getting them from the placenta? Are you getting from, where do you guys get yours from specifically? What body part?
Okay, so it depends what we're treating.
Yeah. Okay,
So
gotcha.
typically the cord cells, which are derived from Wharton's jelly, are better for connective tissue, whereas placenta-derived cells are more catered toward organ treatments. So for our very thorough anti-aging treatments, and then also treating the chronic diseases, we're going to be using both types, as well as exosomes and a stromal vascular factor, which basically helps activate the stem cells in the body. So we're attacking from all angles, and they're very synergistic when used together for overall body health and anti-aging.
And you're not getting yours from aborted fetuses.
No, those are dangerous.
Who's doing that? Like a lot of clinics? I mean, we don't have to name names.
No, I don't think most clinics aren't doing that anymore. I think that was more so toward the very beginning of this, when we're still doing research. But I mean, the problem with those cells is they can turn into basically any kind of cell in the body.
Yeah.
Whereas the placenta and umbilical cord cells are younger, so they're a lot less risky.
Yeah.
Essentially no risk.
Incredible.
Yeah.